Hello and welcome to Vital Signs. I'm Dr. Sanjay Gupta. Our global look at health knows no boundaries. And this month we travel to England to bring you a medical story with truly universal appeal, one that could have happened anywhere. Imagine not only losing a loved one, but losing them after you thought they were handed a second lease on life. That's exactly what happened to the family of Matthew Millington. He's a 31-year-old British corporal and Iraqi war veteran.
I saw it as the cure. I thought that everything would be fine once he had a transplant, bearing in mind, except for this illness. He was a young man, he was a healthy man, peak of his fitness apart from his lungs, so I thought replace them and he would be fine.
Matthew Millington needed a double lung transplant because of a terminal respiratory condition. But a cancerous tumor was found on those transplanted lungs just 6 months after the surgery.
I was still convinced that he was going to be okay in the end.
1 year after the transplant, Matthew died of lung cancer. His donor lungs had come from a person who smoked 30 to 50 cigarettes a day. The hospital's response? Its practice of using organs donated by smokers is, quote, not unusual and in line with international norms. In fact, almost half of all lungs transplanted in the UK are from smokers. And you might be surprised to hear that experts say the worldwide numbers are fairly comparable.
But you have to put that in the context. Only 1 in 8 donors was able to donate their lungs. So actually there's a huge selection process already gone on before lungs are donated. We know that 1 in 5 recipients will die on the waiting list without actually getting a lung transplant. So you're balancing pushing the boundaries to use more lungs or risking problems with the organs and against the recipients actually dying on the waiting list and never having the chance of a transplant.
Consider this. Some 1 million people worldwide are in need of new organs, but only 100,000 organ transplants are performed every year. This is a dialysis clinic at Addenbrooke's Hospital in Cambridge, England, where some patients wait 5 years or more for a new kidney.
No one wants to use an organ that won't work. No one wants to transmit a disease, certainly not cancer, to a recipient. They are, after all, our patients. Our main interest is in getting these patients back to a normal life. And then you have a difficult decision with some organs. We think this will work, it seems to be working fine. I may have 1 or 2 misgivings, but it seems to be working fine. We should take a chance.
You have such hopes, such hopes of a normal life. Even if it's for a few years or 10 years or whatever, you have that hope that you're going to get this and everything's going to be all right. When you get a call that time of night, you just know what it is. Said, good news, we've got heart for you.
But after receiving that heart transplant, Karen Richardson's husband, John, never regained consciousness. Her despair doubled when she learned about John's donor heart at an inquest into his death.
I was just really shocked what I heard. There was a hole in the heart when they had to repair it.
After John's death, it was also revealed that his donor had committed suicide.
The paramedics they worked for 15 minutes to get a cardiac output on him. I just felt this heart was never viable.
Karen says she and John were never informed about the possible risks from the donor's death. Transplant centers around the world have widened their definition of donor suitability, accepting marginal organ donors with less than ideal medical histories. The practice is not illegal, but it raises a host of difficult ethical questions. How much of a say should patients have in the decision to transplant a marginal organ? For now, there are no clear answers. Experts like Chris Watson say the pluses outweigh the risks.
You may think the organs aren't ideal, but nevertheless they were working in the person who donated them. So there has to be an anticipation that the organs will work in the recipient.
But Karen Richardson's personal loss gives her a different perspective.
I'm not against organ donation, I'm just against this marginal factor. I'm not a specialist, it's down to the doctors, but I do think people have the right to be informed, know what the risk factors are, and then make your choice. It's very difficult, isn't it? Because at the end of the day, there's lots of people waiting for organs, but it's also about quality of life and what the possible outcome is going to have. Some people could wake up and have more problems than they started with. So I think we have to be very aware of that.
Up next on Vital Signs, she didn't know she received a diseased liver, not from transplantation, but from birth. We're going to introduce you to the teenager who's blazing a trail to wipe out a disease and its stigma by the time she's 21.